I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. This month's episode is titled Trauma-Informed Care. Did you know 66% of people in substance abuse treatment report childhood abuse or neglect? 70% of adults in the U.S. have experienced some type of traumatic events at least once in their lives. That's 229 million people. In public mental health settings, over 90% of clients have experienced trauma. At NCSS, we need to presume that the clients that we serve have a history of traumatic stress and exercise universal precautions by creating systems of care which are trauma-informed. Now I'm pleased to introduce this month's guests. They are Samantha Thomas, Integration Project Manager, and Michael Bombard, Principal of the SOAR Learning Center. I'd like to welcome both of you to the show this month.
Thank you for having us, Joe.
So let's begin with, what is trauma-informed care?
Sure. So trauma-informed care is a strengths-based framework that really uses principles of safety, empowerment, choice to promote cultures where people feel safe. When I think about being trauma-informed, I think about a perspective shift from what's wrong with you to what happened to you. And we don't stop there. Then we ask, what do you need? What can we do to be helpful? What I think is really exciting is that these words, trauma-informed care, haven't been around forever, and more folks are using those words and really thinking about how can they improve their organizations. There's lots of resources out there where folks can get support to begin trauma-informed journeys. One of those resources is the Substance Abuse and Mental Health Services Administration, and they've done a tremendous amount of work to describe trauma-informed care and make it really accessible. And so I'm oftentimes talking about the 4 R's of trauma-informed care. And so what they do is they highlight that the first R is that you realize the impact of trauma, the prevalence of trauma, and that you realize that there are paths to recovery and there's hope for healing. The second R is that we can recognize the signs and symptoms of trauma in folks. At NCSS, we are recognizing those signs in our clients, in our colleagues, and anyone that we interact with. The third R is that we respond by integrating the knowledge that we have in our policies and our practices. And one of the things that's really exciting about trauma-informed care, particularly at NCSS, is that we're not sharing this information just with our clinicians and our clinical staff, which some people might think that's the right fit. But we really share this information with everyone because we're really talking about a culture shift. And everybody that works at NCSS and has a relationship with us has an impact on our culture and can help to improve that. The last R is that we seek to actively resist re-traumatization. And basically what that means is we live in systems and we work in systems where sometimes we've done what we've done because we've always done it. And we haven't really thought about, why do we do that? Why do we have that practice? Why do we have that policy? And is it respectful of someone who's experienced trauma? And so it's really important when you're thinking in a trauma-informed lens to be able to look at those practices and those policies, put yourself in the place of someone who has experienced trauma and think about, is this respectful of their experience? Does it honor their experience? And does it show them that we have a hope for recovery and that we believe that healing is possible? SAMHSA goes on to define 6 key principles of trauma-informed care, a couple of which are empowerment, voice and choice, safety, cultural awareness, And what those do is they help to further guide us in paying attention to elements that will help us to be more trauma informed and trauma aware.
Now, how did NCSS begin its journey towards being trauma informed?
So what's really cool is that we've been doing a lot of this work for a long time. Michael and I were a part of bringing a treatment modality in our Children and Family Division called attachment regulation and competency. And that model is very much grounded in trauma-informed care. And so we started doing that a long time ago.
Yeah, a long time ago.
Yeah.
We were ready for trauma-informed care because of that. Yeah.
Our official kind of kickoff at NCSS was we participated in a learning collaborative with the National Council on Behavioral Health starting back in 2014. And we were able to submit our application, and as I understand it was pretty competitive, and we were chosen to participate in a learning community. And we started to learn from the National Council about 7 domains of trauma-informed care. And we started to measure ourselves in those domains. So we looked at workforce development. Do our staff have what they need to understand what it means to be trauma-informed? Do they have the resources that they need to effectively work in a trauma-informed way? We looked at screening and assessment. Are we being respectful of our clients in the way that we ask questions? Are we asking questions about trauma history? We looked at, what is our connection to the community? How are we outreaching to the community? We looked at our consumer-driven care. We want to make sure that the folks that are accessing our services have a voice in what we're doing. So there were 7 domains that we started looking at, and we used an organizational self-assessment that we had staff complete so that we could get a feel from our staff. How are we doing? And every year we complete that assessment, and we learn from that assessment, and we make a strategic plan to address those pieces and those needs. We created a trauma-informed care committee, of which Michael and I are a part of. And it's a cross-divisional committee. It includes representatives from our 3 service divisions, also our admin division. And we also have consumers on our committee as well, keeping their perspective at the table so that we can do the best work that we can.
And an important component of this, and the principles that Sam has already mentioned, that these can be applied to any type of organization. It doesn't necessarily have to be a behavioral health organization like our own. It could be a hospital or a school or another type of institution. The important thing is that you get an administrative commitment so they can actually let people revise the policies and practices and procedures that would be a barrier to creating a safe environment where people who have experienced trauma can feel safe and start healing.
Now, Sam, you mentioned initially that NCSS competed years ago. And my understanding is back then, we were one of the first organizations nationwide, if I'm not mistaken, to have been involved in this initiative. So again, I think the reason I bring this up is this is just another way that NCSS has been innovative, which the organization has been in so many other ways as well. For the community.
Yep, definitely.
So what are some of the activities the Trauma-Informed Care Committee has completed to date? You had mentioned all the various domains and the way that everything is evolving. So how does that look as far as the activities?
We've done some really cool things.
Well, just speaking from a SOAR Learning Center perspective, some of the activities that we've implemented as a result of this is that we make sure that all our staff are trained in trauma-informed care principles, from recognition to understanding where to go to get help, to creating a safe environment for the students down there. So we have a training every year, and we have an in-service every year that is related to trauma. And we also have activities like Unity Day, which is bullying prevention, and we'll have a speaker because, as you know, bullying can be very traumatic to students. So we try to integrate trauma-informed care principles throughout the year that's geared toward students.
Absolutely.
Yeah.
Absolutely. We found when we first started looking at what do we want to do? What do we want to tackle first? We looked at all those different domains and we looked at, what are the ways that we welcome our clients into our buildings, into our services, and we realized we didn't have welcome signs. And we thought, how did we not have a welcome sign, at our buildings? And so that was one of our first strategies where we had some cross-committee collaboration to develop access and create these really beautiful welcome signs that seem so simple,
Yeah.
but I think they have a really significant impact.
They do, and it has actually caused a number of stuff just to sort of broaden our awareness of people from different cultures, allowing us to see things from a different cultural perspective. And I think that has allowed us to create, a wider area of safety for people coming in. Because if you don't understand their culture, you're more likely to inadvertently perhaps re-traumatize someone.
Absolutely. We surveyed our clients about, how are our lobby spaces? What would they like to see? Are they comfortable? We changed some colors to warmer tones. We purchased some new furniture that would allow folks to have choices about what they're sitting in, how close or how far away they want to be sitting from people. And those also seemed like, oh, we should have thought of that forever ago. But those were really great changes that we were able to make. We started doing these TIC tips, trauma-informed care tips. So, once a month or so, we would do an email blast out to everyone that works at NCSS with just a little trauma-informed care tip. And we really have been working on making sure that folks have the information that they need. We developed some language and some information for our client orientation guide so that folks who are coming in and accessing our services see how important this is to us. When you put it down on paper, it can show that commitment. So we've increased trainings, like Michael said, down at SOAR. The clinical divisions have some clinical new employee orientations, and we peppered some trauma-informed care information in there as well. And what's super exciting is that, there's been so many activities outside of our little committee. I said earlier that folks didn't use the words trauma-informed care a long time ago. And, just as recently as maybe 6 years ago, there were a handful of folks who were talking about trauma in conversations, talking about resilience in conversations. And now I love it because I'll smile when I hear folks that didn't used to talk about that at meetings, bringing that up and bringing that to the table and bringing that focus to conversations. It's really exciting.
It's just always in the awareness of people who are working with our clients. For example, I think a key piece that Sam worked on was including trauma-related questions in our assessment procedures. But I think in the past, many years ago, people didn't think about trauma and how it affected what might have brought them there that day, and now that's routine for us. So I think just having trauma constantly be available, trauma-related practices being available to people to use in their everyday work, whether you're the receptionist or a person driving the school bus to school or a clinician, it's important to be able to recognize it and understand how it may be affecting that person.
Yeah, I can totally understand that. And it's interesting because you mentioned something like the welcome sign. And even today, as you go around the community and into other parts of Vermont and what have you, seeing an organization that has a welcome sign to welcome individuals is rare. It really is. Not to say that NCSS is the only one, because we're not. But it truly is, and it goes to show again that welcoming and trying to make people feel, they're very valued for coming to our location.
Absolutely.
So speaking of that in communities and what have you, what are some of the ways that NCSS has engaged community partners?
Sure. So we've done a lot of work throughout Franklin and Grand Isle counties, and sometimes throughout the state. We've had some opportunities to share some information in other parts of our region. One of the things that I think we have done a show on before is building flourishing communities. And that's a really interesting and exciting statewide movement where myself and Mary Pickner are facilitators, where we talk about the near sciences, neuroscience, epigenetics, ACEs, and resilience. And we share that information with community folks so that they can have the information to then make change. So it's not just about the professionals that are making decisions and improving our community, that we're giving information to folks that are living in our communities that then they can say, this is what's going on for us and this is how we maybe could solve it. Super exciting that we've been doing that. We've been in many of our local schools sharing information about trauma-informed care and resilience building. I had a really fun time with the foster grandparents a few years ago. Voc Rehab, Reach Up, Child Care Centers. Lance Mateer and I were out at Camp Abenaki a year or two ago working with some of their camp counselors, which was really, really exciting. And I think what we've really tried to do is make sure that we're getting information to folks, not just folks in the community that are our typical partners, because we see those folks a lot and we can typically get, airtime with them. But when we're thinking about being trauma-informed and making some culture shifts in our larger community, we really want to reach those folks that we don't typically get in contact with. So Lance Mateer and Katie Mabel were just with some rec department directors, which is really exciting to be able to talk about how does our recreation department, our departments, include these principles in the ways that they're providing support to youth in our community. They were at the Maternal and Child Health Division talking with nurses. So there's some really exciting things that we're doing and connecting with folks that we don't typically get to connect with. One exciting thing that's going on out in our community as well is we have a learning collaborative that just kicked off last week with primary care and other community partners. And they asked myself and one of my colleagues out in the community, Joelle Van Lent, to talk about trauma-informed care and how it relates to chronic pain. And that's super exciting. So that's something that we'll be doing in 2020.
That is terrific.
And these principles are, what I feel anyway, are very important to get into the primary care setting. And you may have talked about that on one of these shows before, but I think it's important to mention the ACEs study, the Adverse Childhood Experiences, which some people know, but some people don't. Childhood trauma experiences are correlated with later adult physical health issues. So for people to be screening for trauma, whether you're a child or adult, is very important, and perhaps getting to the root of a physical issue.
Absolutely. Absolutely.
So is there a connection between suicide and trauma?
Well, Joe, that's an interesting question because a growing body of research indicates that there is a correlation between traumatic experiences and suicide attempts, suicide completions. However, when you look a little deeper at the research, there's an indication that it's not necessarily the trauma in and of itself that can increase the percentage of someone attempting suicide. It's not like if you get hit by a car, you have something bad happen to you in your life, doesn't mean that you're necessarily going to commit suicide or you're at a greater risk. It's really if the trauma isn't addressed and it leads to perhaps major depression, severe anxiety, substance abuse disorders, addiction, those diagnoses, those are highly correlated with suicide. So it's the sort of the ultimate consequence of a traumatic experience that raises the risk level of suicide. But trauma in and of itself doesn't cause suicide, and it doesn't make you more susceptible to it. However, if the consequences go unattended, it does raise the risk level.
Yeah, sure, understand.
Which I think lends more value, I guess, to the concept of being trauma-informed, right? Because if you're realizing that trauma is out there and people have experienced trauma, and you're recognizing those signs and symptoms, maybe you can connect with someone early and catch that. You know, there's some prevention that could be done to maybe divert some really scary outcomes.
Right, like
Yeah.
just even things that could, even simple things that can create, like increase one's resiliency to bad experiences.
Yeah.
Yep.
And speaking of that, good segue.
Thank you, Joe.
What about resilience?
Yeah, I don't think you can have a conversation about trauma or ACEs or trauma-informed care without talking about resilience. We're doing a lot of work across our whole agency looking at resilience and how can we support individuals, families, our communities to build resilience. So we also talk about, if you're going to ask about ACEs or you're going to ask about a history of trauma, we also want to ask about resilience. There's some really cool measures out there where we can ask questions about key elements of resilience.
Yeah, because when you look at it from its most simplest perspective, it's two people can experience the same traumatic event, yet react very differently. Someone may have a higher rate of resiliency than that other person. So what did that person experience that allowed them to be able to manage and to navigate that traumatic experience, as opposed to the other person that is more debilitated by that experience?
Yes. Yeah.
And one of the things that, one of the key components is to have a caring individual who believes in you, either within your family or outside your family, someone that makes you feel like you're okay with yourself. You can manage difficult events. It could be a mentor, a coach, a parent, a foster parent, a step parent. It could be they could come from a number of different places, but it's just one. All you need is just one person to believe in you, someone you can look up to, and that is a protective factor. It's one of the main ones. There are several others, but that is one of the most important ones.
Yeah, absolutely. There's a gentleman named Michael Unger. He does resilience research, and he talks about the importance of relationship, and he talks about resilience in a really cool way where he links in the community, and he links in, that there are some individual characteristics that help folks to be resilient, that relationships are important, and that folks having access to the necessary resources in their community increases resilience as well. So it's helpful for us at
Right.
NCSS to be looking at all of those levels in the
Like
ways
social
that we can support her.
connectedness.
Yeah.
You know, getting out there, being connected with people that ultimately could support you during tough times, people that could help you. One of the things we found in children is that children who are more susceptible to trauma, they have a more difficult time regulating their emotions, handling even the smallest sort of frustration or struggle, and just learning, just feeling confident about themselves. Like, I feel like I can handle this. If they feel confident in another area, it's an easier sell to them about developing a skill to handle other adverse events. It may be, look, you handle this very well over here, you can also handle this, and let us teach you how to do that.
Yeah. And I think one thing that's important to recognize is that sometimes it's easy for us to think about kids when they're struggling with their regulation and understanding and thinking about what's going on. Sometimes it's harder for us as adults to look at other adults and to wonder
Right.
what's going on as well. We tend to judge more. And so I think one of the key elements of being trauma informed is understanding that there are some adults who didn't get what they needed, and so they're doing the best that they can, and their behavior makes sense, just like it often does with kids.
right, yeah.
And really expanding that perspective so we can be welcoming and understanding of folks on the whole age spectrum.
Now, how can others start their own trauma-informed journey?
Learning more, getting educated, finding resources. That you Google trauma-informed care or
Right.
whatever search engine of your choice. There's so many resources out there that can give you information. We talked earlier about SAMHSA. They
Right.
have the Tip 57 is all about trauma-informed care.
Was it the National Child Traumatic Stress Network?
Also
They got a
excellent
lot
resource.
of resources there. There are a number of online resources. There are a number of books that you could order. I think if you could also find a licensed mental health counselor, or you could connect with a mentor or a good friend. But that's the first step, is taking decisive action and moving forward and believing that you can navigate these experiences.
Absolutely. And putting yourself in the shoes of the folks that you serve, the folks that you support. I think that was a really big part of our journey that we continue to hold at the forefront.
Now, what's next for the NCSS Trauma Informed Care Committee?
We are working on information and content for our intranet, so staff, NCSS staff, will be able to know what we're doing. They'll be able to connect with us to share their ideas, to ask questions. So that's really exciting. We're developing the content for that. We also want to develop content for our internet, our website, so that folks who are coming to learn about NCSS can see that we're committed to being trauma informed, and we can share some information and some resources. We're poised to do our yearly organizational self-assessment, so we'll be looking at how we've been doing over the past year and figuring out, what's next.
And we are seeing progress each time we do these assessments. So we do see progress going forward. And some areas we progress more than others, and that just tells us we need to focus on that particular area that we're not going as fast in. So
Yeah. Yep.
Well, I was going to say, I think with each year, there's probably going to be certain elements that maybe one year there was a little bit of progress, the next year maybe not quite as much. Or I don't know, maybe sometimes none at all in a given area, and in other areas a bit more of a
it doesn't
leap.
move evenly.
But it's not,
Right.
yeah.
Yeah,
Yeah.
definitely.
So, this has been very interesting. I mean, it's a journey that I know NCSS began, as you said, officially. What would it be now? It'll almost be 6 years ago, because
Yeah.
you had said back in
2014.
2014. And I know there's been a lot of movement over the 5+ years, all in the right direction. A lot of things that have been addressed to make those who come to, well, number one, those who work there, and number two, those who come for services, to feel it's a safe environment, and that, as I think both of you have expressed, that no matter what cultural background or what have you somebody comes from, is that there is a respect level and an attempt to truly help them with whatever it is that they're struggling with, and doing it where they're comfortable.
Absolutely. I think one other thing I think about when I think about our journey is looking at, what were we already doing that was trauma informed? Because there was so much that we were already doing as an agency and as an organization. And I would encourage other folks that are considering becoming trauma informed to already look at, okay, what are you doing well? What's going well right now? What are you doing that's offering voice and choice? And then build on that, so that it doesn't feel like it's kind of another thing, a flash in the pan, if you will, because it's not. It's here to stay.
right,
Yeah.
for sure.
Yeah.
Yeah.
Well, I want to thank my guests, Samantha Thomas and Michael Bombard, for sharing their insights about trauma-informed care and its importance in creating in safe environments, providing trauma-sensitive services, and addressing self-care. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about all of our NCSS programs and services by visiting ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.